पद्मश्री डॉक्टर राजेंद्र ए पड़वे, कैंसर सर्जरी के क्षेत्र में एक जाना माना नाम। मुंबई स्थित टाटा मेमोरियल सेंटर के डायरेक्टर और सर्जिकल ऑन्कोलॉजी डिवीजन के प्रमुख डॉक्टर पड़वे ने कैंसर ट्रीटमेंट को एक नई दिशा दी है। कैंसर ट्रीटमेंट में विशेष योगदान के लिए उन्हें देश ही नहीं विदेशों में भी कई सम्मानित अवार्ड से नवाजा जा चुका है।
Breast cancer is on the rise in cities, in mid-sized towns in India, and this rising cancer is because of our changes in lifestyle. There are 2 or 3 very important causes that contribute to rising breast cancer. The first and the foremost is delayed first pregnancy. Longer the time interval between beginning of menstrual cycle in a lady to the first full term pregnancy, greater is the risk of breast cancer. To give an example, the average age at which the first pregnancy took place about 40 years ago was about 20 to 25. Today it is between 27 and 28, and in the United States it is about 32. And the incidence of cancer in villages where the first pregnancy is still at 22 or so is barely about 8 per 100,000. The same number in cities is about 30 per 100,000, and the same number in United States is about 120 per 100,000. So, having first child between the age of about 23 to 26 is ideal. The second important correctable cause is breastfeeding. Breastfeeding the child for at least about an year is another important contribution to preventing breast cancer. And a third, which is also preventable and important cause, is obesity. Obesity after the age of menopause is an important contributor to rising breast cancer. Obesity not only increases breast cancer, but it also increases uterine body cancer, it increases ovarian cancer, it increases kidney cancer, it contributes to colon cancer, it contributes to the lower end of the food pipe cancer. So, large number of cancers are related to obesity, and obesity is also related to diabetes and blood pressure. So, सब दुखों की एक दवा, वजन कम करो। Breast cancer most commonly presents with painless lump. Lump in breast that is painless anywhere between the age of 35 to 75 and any age beyond indicates cancer, and as the age advances, as we go beyond 50, the possibility of cancer is very high, whereas between 35 and 45 it would be there, but it is not as high as it would be when a lady comes to me with a lump in breast that is painless at age 55. The other symptoms which are also sometimes lead us to think of cancer is blood stain discharge through nipple, but this is not a very common cause at all, common symptom at all. Pain in breast or pain in the arm is very rarely a symptom of breast cancer. So, 95% of the women present to us with lump in breast. I would say that for a lady who is postmenopausal, but not in premenopausal women. So, younger women, there can be many other causes like cyst, fibroadenoma, a fibroid, and sometimes the interaction between changing menstrual cycle and breast. All these can produce lumps, but they are of no significance and they don't indicate any cancerous affliction at all. Breast cancer, first of all, is immensely curable. So, when I say 80% cure rate in stage 1, I am saying 80% chances that the woman will live up to her age of 80. So, excellent cure rates. The treatment for breast cancer essentially is a combination of surgery, radiation therapy and chemotherapy, and sometimes hormonal therapy. Now, surgery today in early breast cancer does not mandate removal of breast. 70% of women coming to Tata Memorial Hospital for early breast cancer do not lose their breast as part of their surgery. What I do, and what is also the standard of care, is removal of the lump and removal of the glands in the armpit. That's all that is necessary surgically in this woman. By virtue of saving of breast, it would be mandatory that the lady has radiation. The need for chemotherapy, hormone therapy and the newer targeted therapies is based on sensitivity of the tumor to each of these modalities. So, after surgery, when about 8 to 10 days have passed by, when I get the final report, there are two facts that come to me. The first one, how much is the risk that the cancer can come back? And second, what is the sensitivity of this tumor? So, marrying these two information that I get, it is decided that if I were to give chemotherapy, how much of this risk will come down? Or if I were to give hormone therapy, how much of this risk will come down? And based on that, a doctor takes a call whether a lady needs chemotherapy, hormone therapy or targeted therapy. Mammography is a useful tool in women above the age of 50. It is a useless investigation below the age of 50 for early detection of cancer. So, this should be driven home and importantly remembered that mammography is not effective below the age of 50 when a woman has regular menstrual periods. This has been an extremely effective modality outside of this country, especially in the United States, and the reason being that almost 60% of their population is above the age of 50, whereas in India 85% of the population is below the age of 50. So, an investigation which is effective above the age of 50 will not be useful in India. No country in any part of the world offers screening with mammography below the age of 50 because it is ineffective. In fact, it can miss cancer and push a woman into procrastination and quietude. Rarely, for every 100 women getting breast cancer, one man gets breast cancer. And again, it is strongly related to obesity. Absolutely. The answer to that question is woman can come back to normal life. Now, in what all places can she come back to normal life? If I operate on a lady today, the lady goes home tomorrow, and tomorrow she can drive home herself. That much of normalcy the very next day. In a span of a month, she can play tennis. And once the chemotherapy, radiotherapy, everything gets over, in a span of about 8 months or so, the life can be normal with breast conservation. So, it is not just quantity of life, but even the quality of life is absolutely normal. The quantity is entirely based on the stage at which a woman is diagnosed, and if she is diagnosed in stage 1, we are talking about 80% chances of living up to 80. Cancer in India is low, as I had mentioned earlier, and we can lower it further. 70% of cancer in India is preventable. If we were to stop tobacco, tobacco in any form will reduce at least about 10 different cancers in various parts of the body. It will reduce hypertension also. The second, personal hygiene. Personal hygiene for men will stop transmission of viruses that can produce cervical cancer, that can produce and induce sexually transmitted diseases, and penile cancer in men. Cervical cancer in women is prevented by personal hygiene in men, which can be achieved by cleanliness, by using condom, by using having circumcision very earlier on life. And all these three can reduce cervical cancer to a great extent. And lastly, obesity. We need to tackle obesity, and this is a problem in cities of India, in mid-sized towns of India. We eat a lot, we don't exercise. We need to do something to maintain ourselves at an optimum weight, and that can be done by physically doing lots of things, maybe exercise, maybe walking. And I would say if you are walking for any work within a kilometer, please walk.